I'm now going to demonstrate for you an examination of the foot ankle. Let's assume our subjective examination is complete and there was no indication of referred or radicular pain. If there were such complaints, we'd perform a full lower quarter screen. Let's start by having our patient stand up, and we're going to observe the lower extremity alignment. So what we're going to do is look at the hips, the knees, and the ankles. Patient can lift up his shorts slightly so I can check out the knees. Good. So I'm looking specifically at the subtalar joint to see if there's excessive pronation or supination. Good. I then can come down here, and I'm going to have to ask the patient to do a unilateral stance. So I'm checking for any motion at the subtalar joint, see if that navicular slams against the floor. Good. Any pain there?
No.
Okay. And the other side? And we're looking at balance as well, as chronic ankle instability issues can really lead to a loss of balance. All right there? All right. Now let's check out the gait by having my patient walk both toward and away from me. Looking what's going on at the subtalar joint as well as the knees. And have my patient both toe walk and heel walk to assess both balance and muscular strength. Any problems there?
Nope.
All right. And there's numerous other functional screening tools that we can use in the clinic, but for the purpose of this video, we'll cut it short and go into active range of motion. So I'm going to have my patient supine on a plinth with the legs hanging off. Good. Flex this one up. Thank you. So first we'll do active range of motion plantar flexion by having the patient pretend he's pushing on a gas pedal. Good. And come up into dorsiflexion. Good. Lifting the toes to the ceiling. Any pain with that?
Nope.
No pain. So we can help our patient position themselves into inversion. Good. And eversion. Any pain?
No, sir.
No pain. Now we can do our passive examination. So I'm going to take my patient into plantar flexion. Any pain?
Nope.
And dorsiflexion. Any pain there?
Nope.
We can also go into eversion here, stressing the medial deltoid ligaments. Any pain?
Nope.
And inversion, stressing the lateral ligaments, like the CFL and the ATFL. Still no pain?
That's correct. No pain.
No pain. So let's check out the passive motion. So we're going to do flexion of the toes and extension of the toes. Any pain there? Still good. We can now move on to our passive accessory exam. So I'm going to start by doing an anterior to posterior glide at the subtalar joint. Any pain?
Nope.
Nope, no pain. And we're always looking for concordant sign here. So now I'm doing a posterior to anterior mobilization at the subtalar joint. Any pain there?
No.
If there were pain, we'd want to try to assess for repeated motions to see how that affects the patient's pain. We can then assess the midfoot by both inverting and everting. Just at the midfoot there, so we're assessing the mid-tarsal joints. Just like that. Any problems there?
No.
In this position, we can also test muscular strength. So I'm going to position my patient into inversion and ask him to resist me. Good. Come all the way up. Good.